So gene replacement therapy data that was presented at the Child Neurology Society meeting can also be thought of as in the pre-symptomatic or the symptomatic phase of SMA. The one thing that was highlighted as a continued effort was the phase 1/2A data, and the poster presented showed that there was continued improvement in terms of motor milestones for this pilot study. Along those lines, the phase 3 study in STRIVE, which is the IV infusion of the drug in children younger than 6 months of age, showed rapid improvements in motor function. And that's the symptomatic phase. The other symptomatic study that has been ongoing is the STRONG study, which is the intrathecal delivery of the gene replacement therapy in children that are older, and that has also shown rapid improvements. The safety as a outcome measure has been analyzed, and it continues to be monitored as a part of all these studies.
So that gene therapy that was approved was given intravenously, but there are studies that are ongoing which were focused on intrathecal one-time injection of the same gene therapy product. And the data that was presented in this meeting showed similar efficacious profile as well as the safety profile. In fact, the safety profile is much better than the intravenous infusion of the gene therapy.
So the presence of anti-AAV9 antibodies could have a significant impact on whether a patient is a candidate for gene therapy using a vector, using an AAV9 capsid. So the gene therapy that's being used for spinal muscular atrophy is an AAV9 capsid, and high titer levels may potentially prevent or decrease the efficacy of such a drug. So when the titers were looked at across all the different gene therapy clinical trials, they found that approximately 5.5% of the patients that were screened for all the different clinical trials for this gene therapy product had to be excluded based on this. This indicates that it's still a pretty low number of patients in this age group that would be excluded from receiving gene therapy based on this criteria. Yeah, so some of the infants that test positive may be positive because of maternally transferred antibodies, so either transplacental or even perhaps in the breast milk. So one of the strategies that is used is to retest after a couple weeks to see if the titers attenuate on follow-up testing.